In this video, I want to talk about the structure and function of the serratus anterior muscle. So the serratus anterior is often known as the boxer's muscle because when a boxer throws a punch, that forward protraction locking the shoulder blade into position where you can see these striations along the rib cage, that is the serratus anterior muscle in action. So if you think about the function of the serratus anterior, it helps draw the scapula laterally. It helps with upward rotation and posterior tilting of the scapula. What that means is that when the arm is overhead, the serratus anterior helps draw the shoulder blades back and lock the shoulder into position for stability with overhead movement. If you look at the structure of the serratus anterior, it has attachments on to the first one, two, three, all the way down to the ninth rib there. So it directly connects from all parts of the upper rib cage onto the inside angle of the scapula. So if you look at the inner attachment here, as you activate that muscle, it's going to hug the inside angle of the scapula and then allow for upward rotation, some posterior tilting, which keeps you moving fluidly with overhead range of motion. Now, this muscle I think about as one of the most important shoulder blade muscles. It works with a as a force couple with the upper trap and the lower trap. And then I often think about it as connecting with the lats as well quite a bit. Because when I want someone to activate through their serratus anterior, I'll use the cue of pulling the shoulder blades down, engaging there, and then giving some press out that way. For this reason, some of the simplest ways to work on it would be getting into a plank position. So you could start in a forearm plank, bring the shoulder blades down, down, and then pushing away. That action of pushing away where we're stable through our rib cage and then pulling protracting the scapula, pushing your elbows or your forearms away from the ground, that action there is what really turns on the serratus. Now we know that it's more important in overhead position. So then from there, we need to maybe do some sort of Swiss ball plank sliding type of movement, or we could even with a band, having a band around the forearms, pull the band apart and then raise up overhead there. But those sort of actions where you can really feel the scapula wrap around here and all this activation turn on in the lower part of the under the armpit into the shoulder blades, that's how you know the serratus anterior is going to work. So some of my favorite ways to do this, like I said, the plank with that specific protraction, the push-up plus position, a banded wall slide or a foam roller wall slide where you're engaging, pushing forward first, so in using protraction and feeling the posterior tilt of the scapula. As you do those, sometimes people, as they push in, then it'll start to rise from here more. That is more of an upper trap exercise at this point. So what we need to do is one, isolate the down motion and then pushing forward. So again, that's down, pushing forward. You see how that draws forward there? That's going to open up this part of the movement and then sliding from there. This muscle is so important because if it's not turning on and posteriorly tilting the scapula, as someone raises up overhead, it'll often rise and then impinge through here. So you'll see this compensation with glenohumeral movement, which impinges the humerus in that subacromial space right there. So as if I am pinching here, and then I can use that serratus to wrap around and pull through here, that takes pressure off the top and it allows the shoulder to move through full range of motion. As I said a minute ago, the serratus anterior works with the upper trap and the low trap as a force couple. So that's when a force couple is when two or more muscles work together to create an action. And we have these force couples all over the body. But if the serratus anterior is not working in conjunction with the upper trap and lower trap to create that upward rotation of the scapula, then what happens is we see shoulder impingement, we see wear and tear on the rotator cuff because of this unilateral pull where those muscles aren't working together. So we need to strengthen the serratus anterior in isolation, and then we need to work on it in these combined movements, specifically working to train it in overhead positions because that's where the serratus anterior becomes even more dominant or even more important from a functional standpoint.